Hello, everyone. My name is William Pascal, and today I will be talking about the effects that lower income has on the health of Americans. To kind of introduce this subject, I chose three different concentrations for research, and they were the healthcare, finance, and political science discipline. These three disciplines take a unique look from three different perspectives at three of the major aspects to this complex problem. Healthcare being what's needed, finance being how do we make it work, pay for it, and political science being the governmental backing that's required in order to make it happen. Just kind of start off, private healthcare options are subpar compared to public options. In over 24 different countries, they have done research showing that private healthcare often offers options that are needless medicine, as well as not even up to the same standards as public options. Low-income families having low labor participation, steps the government has taken in the past to make healthcare more readily available, and then finally, to answer the question, can a governmentally implemented doctrine help provide free healthcare for those in need? I would first like to take a look at the complexity of this issue. Which the issue is very complex and has a lot of moving parts that justify interdisciplinary research. The complexity of this problem is not in question, as it affects a large population of the American population. Using this, we take a deeper look into how low income affects a group of people's ability to get health care they need and the health care everyone else has the ability to get. Without proper health care, this group is marginalized and loses the ability to get and stay healthy. As stated in the introduction, the three disciplines that I chose to look at were financial, healthcare, and political science. Each separate discipline falls into a category for a solution when talking about this issue. Finance is a direct look at how much overall costs for implementing a bill would be. Healthcare looks at the actual field itself and finding ways to make it more readily available. Political science takes a look at the government actually putting the bill into motion. These disciplines are necessary for preventing this issue from becoming a wicked problem rather than a complex problem. People on both sides of the political spectrum will likely never agree with what's about to be discussed, but at the core of the issue, these low-income families don't have the same opportunities and ease of access to health care that upper-level income families do, and I would like to solve that. So we're going to take first off a look at the financial discipline. The finance discipline helps us take a look at the differences between low-income families and how they work. Pamela Loprest and Amy Davidoff looked into this by publishing a research article looking directly at labor participation from these different levels of income. Their research concluded that 25% of low-income families have no working parents and have a special health care need, compared to the 18% with no working parents with no special health care need. This correlates directly to families having health care issues that they simply cannot help due to financial reasons. Families who need health care options are not getting it due to a lack of working parents / income flow that helps them afford it. The AAFP offers different resourceful ways to attack this problem. According to their research, the only way to make healthcare free is to look at it from a pluralistic healthcare system approach. A pluralistic healthcare system takes nonprofit and for-profit organizations and makes them team up to give the general public healthcare coverage. So basically, looking at a pluralistic healthcare system, it allows the American community to work together in order to solve an issue that's complex, that takes a lot more than just one side figuring it out. Using that combination of private and public healthcare options, we would then apply a publicly administered plan in the form of a public option approach. And then it'd be a very large financial task, but based on the research done in an article done by the RPC Senate website, in order for free healthcare for all the government, it would take an influx of $32 trillion in cash and a 20% tax raise to get free healthcare and to be feasible. It would completely get rid of the need for insurance companies and put all the healthcare responsibility onto the ruling government body. And it's where we see a lot of complications coming from making it happen, getting 100% of America to agree on this going forward is going to be extremely hard. On top of this, we see a lot of job loss with private insurance companies. A probable solution can be found by using a financial pros and looking at the tax rate that fluctuates. A variable tax rate depending on the income level. People with low incomes below $39,500 would have health care provided by the government. So basically, if you fall into the lowest tax bracket, which is of or at below $39,000 and $39,500, your health care is going to be completely free. These upper level incomes, people that are making billions of dollars and would never be able to spend all of the money that they have, will have a variable tax rate depending on the amount they make. And I think that's completely fair. If you have hundreds of billions of dollars, I think it's your civil right to be able, or to have to, at least help in any way that you can, considering you have more money than you'll ever spend before you die. The next discipline I want to take a look at is the healthcare discipline. So first and foremost, low income ultimately correlates to a lower quality of life. In a journal of community health nursing, Mallory Lazar stated the problem of limited or non-existent access to health care for low-income families and children is substantial. She then found that low income leads to lower mental health and low self-esteem developed from that lower quality of life. These specific factors all mostly go undiagnosed because you need money to diagnose things from the doctor. And mental health issues like anxiety and depression are very common among low-income families. These factors all lead to a large amount of low-income persons and families to go with undiagnosed depression and anxiety, as well as many other diseases, causing them to overall have a much lower quality of life than the rest of private America. And then, as stated in the introduction, private healthcare often gives out more needless means of medicine than public healthcare. In a study done by Sanjay Basu for the PLOS Medicine Bureau, he studied 24 different countries that showed the differences in private and public healthcare. His study found that private healthcare in all these countries gave out much more needless forms of medicine as compared to the free public healthcare. I think that study's a big red flag. It shows that public healthcare is a much more affordable option that offers better medicine practice, but is being overshadowed by paid healthcare options offering subpar healthcare options. This research directly shows why the need for public nonprofit healthcare option is needed. And now we're going to take a look at the political science discipline. So the government has been trying to regulate some form of healthcare for over 100 years now. Looking at research done by Kent Patel and Marky Reshevsky, it shows that even dating all the way back to around 1912, President Theodore Trump attempted to help industry workers. He tried to use his platform to campaign for health insurance and free health care for industry workers. So these are the people that were going into mines, building railroads, doing all that kind of stuff, and very dangerous jobs, who didn't have the ability to have free health care, putting themselves on the line quite literally to build America. And Theodore Roosevelt fought for this in order to get them the health care they deserve. And then moving on to the 60s, we saw the introduction of Medicare and Medicaid, which began paving the way for reform on healthcare policy in America. All this led to the introduction of Obamacare in 2008, which had the lowest premiums, pretty much, that we've seen so far in government offered healthcare, even more to those in need. Julie Gesmarian wrote a report that said healthcare professionals have a major challenge when it comes to dealing with a major issue like this, and that is the government can't streamline definitions of free healthcare options that are both scientifically and easily understandable by the public. This basically means that they can't find a way to transcribe it to make people understand, this is exactly what it does, but it's also in layman's terms so that people can actually understand it. And based off of that, there's going to need governmental help to step in and make a bill like this feasible. Under the bill proposed, there will be two major things added. The bill will completely take away the necessity for low-income families to pay anything for health care by using proper stimulus. And this bill will also include creating a division under the Department of HHS, which is Health and Human Sciences, that's purely dedicated to educating the public and making science-based terms to easily understandable to the public. And then, as talked about earlier, some of the major conflicts that come up in this is the ability to finance a bill like this and making it pass in the government. I mean, as stated earlier, we would need $32 trillion to go on top of the debt of however many trillions that we're already in, and a 20% tax rate that would raise taxes for pretty much all of America that's over the poverty line. And, you know, that's a tough ask for a lot of people. And making that pass in the government is even harder. Between the split decisions between Republicans and Democrats in our two-party system, it's going to be really hard to get them to agree 100% on something. And that's one of the major conflicts, is getting people to agree to finance something like that. And also another thing is going to be getting people to agree for free healthcare for only a margin of people. I think it all comes down to people, you know, wanting the same opportunities as everyone else, but that's what these low-income families want. I know that there's going to be people that are above the poverty line that will be like, man, I want free healthcare, but you can, at the end of the day, you can afford it. At the end of the day, you can afford it, and then these people can't afford anything. These people are barely living. There's 25% of them that don't even work. So, and then 100% Americans will not agree on the bill proposed using the three disciplines. This is just guaranteed in anything. America is probably more divided now than it ever has been. We have protests going on in the street. We have people lobbying for days to make sure that bills don't pass. It's going to be impossible, nearly impossible, to get 100% of Americans to agree on a bill like this. And that's just some of the major conflicts that pop up. But in conclusion, people in America genuinely need help. Large sections of the population have no access to health care because of their current financial situation. We need to understand that this is an issue that is bigger than ourselves and affects our population as a whole. A universal blanket bill that applies a variable tax rate to more wealthy sections of America is the best way to make sure our fellow Americans can no longer suffer. There will be certain guidelines with the bills, which basically going into a stimulus every month that would pay for your health care. You must be pursuing getting a job or employed in order for you to receive any form of help. You can't just live off of unemployment for your whole entire life. That's not what this bill is here for. This bill is to actually help the people that need it. And putting these guidelines in the test is going to be exactly what needs to be done. Giving people free healthcare is a great thing, but it can be abused. As stated earlier, with the bill, there would be mandatory action that if you were able to work, you must get a job, or you will not be able to receive the benefits from this. And then going on, you must pass drug tests. People need to be off drugs. We need to make sure they're not spending this stimulus on drugs and using it for actual health care for their families. Finances will be regulated to make sure the healthcare money is not going towards other things of different uses. And if all of these are regulated, it will lead to a much better quality of life for a large amount of people in the American population. Thank you for listening. I appreciate it, and I hope that you learned a lot.